My name is Dr. Komoshi. I'm a GP at King's North Medical Practice in Ashford. In this series, we look into common medical conditions that could be treated at home without the need to see the GP. Hay fever or allergic rhinitis affects 1 in 4 adults in the UK, so it's very common. The classic symptoms are sneezing, itchy and runny nose, itchy ears, eyes, throat, and blocked nose, swollen and red eyelids. The most common allergens are tree pollens, starting early in spring, then in midsummer the grass pollens come on, later in the summer and early autumn the wheat pollen, and later in the autumn it will the molds. Some people are unlucky enough to have hay fever symptoms all year round. They might be allergic to house dust mite, animal dandruff, or they might have some occupational allergies. Hay fever causes a lot of discomfort, however it's very rarely life-threatening. But if you have asthma, you really need to take your hay fever seriously and treat it proactively, because if you leave it untreated, it can affect your asthma control and give you an asthma flare-up. The two sides of the treatment would be first reducing the contact with the allergens. The second is to reducing the body's reaction to the allergens. Both are equally important. So to reduce your exposure to the pollens, you might want to wear a tight-fitting face mask and wraparound sunglasses when you are out. Try to keep the windows closed in your car and at home, especially in the early mornings when the pollen count is the highest. Try to avoid gardening activities or walking in grassy fields in the pollen season. Don't dry your washing outside, and try to wash your hands and hair, your face quite frequently in the pollen season to reduce the pollens in your hair and on your skin. You also might want to do the same with your pet, wiping their fur off or bathing them more often. You might want to use a little bit of vaseline into your nostril before you leave home. It works as a trap to the pollen, so they won't go up to the back of the nose. Or you might want to try to do douching, nasal saline douching, to try to wash out all the pollens from your nasal cavity. To reduce the body's response to the pollens, the mainstay of treatment would be antihistamines. Piriton is an old antihistamine that is considered sedative. So if you want to be able to drive and operate machinery and get on with your life, you might want to avoid Piriton and use a more modern version like cetirizine or loratadine. These are available for cheap from the chemist. None of these antihistamines are stronger or better than the others. And fexofenadine, that used to be a prescription medication, is now available over the counter since 2020. You don't need a prescription for that. As I say, none of them is better or more effective or stronger than the other. There's no need to mix them, to take one antihistamine in the morning, one in the evening, or alternating them daily. However, some patients find it useful to rotate their antihistamines every season because they find that the old one is not working as well as the previous year. Again, there's no need to buy the more expensive, newer antihistamines like this loratadine, as they are no better than the others. If your symptoms are not completely controlled with the antihistamines, you might want to add a nasal steroid spray. This reduces the allergic reaction in the nose, and also it helps with the eye symptoms. It's important to start the treatment a couple of weeks before your season starts, because it's not an instant medication. It takes a few weeks to build up in your system and help to reduce your symptoms. You can use Beconase, which is available over the counter. You can use 2 sprays twice a day to both nostrils, adding up to 8 sprays a day. It's very important how you use the nose spray so it goes to the right place. I put a video link in the descriptions where you can check out how to use the nose spray correctly. I would recommend not to use decongestion nose sprays like Vicks for longer than 7 days, However, you can add this into the mix if you are really desperate, just for a few days. Eye symptoms are normally well controlled with the nasal spray. However, if you want some extra help, you can try chromoglycate eye drops, and your chemist can help to find them on the shelves. Combination of these treatments are normally enough to control most people's hay fever. However, if you're still suffering significantly, then this would be the time to call for your GP. They can offer you montelukast, which is a medication used for asthma treatment. However, can be safely and effectively used in hay fever. If you're completely fed up with your hay fever and you want to completely get rid of it, you might want to consider immunotherapy. This is a 3 to 5 year process, giving you low dose of the allergens, either as tablets to put under your tongue or as small injections. However, the treatment is very rarely available on the NHS. If you are looking into that, you might want to find a private provider. There's one important thing that I left for the end. Some private clinics offer a hay fever jab called Kenalog. This could be a quick fix, and that you have one injection at the beginning of the season and you're covered for the whole year. However, the MHRA, the Medication Safety Agency, stopped these clinics because of the dangerous side effects of this injection use. So from August 2022, it is discontinued. I hope that you found this information helpful and you can manage your hay fever better. Bye for now.